Welcome, everybody, to our Vaccine Center of Excellence program. This is our fifth and final workshop. So we started out west in British Columbia, made our way to Alberta, Saskatchewan, last night in Ontario, and now we are covering the Atlantic provinces. So thank you so much for joining us today. We have a very special workshop with an excellent speaker on deck, and I will be moderating today's discussion. So my name is Ajit Johal. I'm a pharmacist from British Columbia, and I'm also the co-founder of Immunize.io Health Association, which is hosting these events, as well as the entire Vaccine Center of Excellence program. I'm joined by my co-founder at Immunize.io, pharmacist Mark Zhao, and we'll be leading this workshop, and I'll be introducing our speaker shortly. But to start off with, I want to talk about what this is all about. What is Vaccine Center of Excellence? So what it is we want to build on the success of community pharmacy vaccination services in Canada. Pharmacists have done a fantastic job with reducing the burden of communicable respiratory diseases like influenza, and recently with COVID-19. Without the immunization capacity presented by community pharmacists, we would not have such a successful national immunization campaign. But we want to take that to the next level. I really think that pharmacists can address all of the immunization gaps we see in the adult population. And we want to highlight pharmacies that really want to make that investment and take the time to offer this service and protect their community against all vaccine preventable diseases. So it kind of looks at this sort of specialization model where, just like in the United States, where if we have a psychiatrist looking for special psychiatric services, there's pharmacies that are designated to fulfill the specific needs for those patients. In terms of what is the role of Immunize.io Health Association, so we're a BC not-for-profit organization started in 2018, and our mission statement is certainly a lofty one, and that is taking our best shot at immunizing the world. So our focus is really on vaccine education and awareness, and we're also really big on facilitating access to vaccinations, and really the best place to do that is at pharmacy locations in the community. So in terms of what we're talking to employers about, because one of our big sort of mandates is to educate the workforce and employers to kind of facilitate better education as well as access to vaccinations. We're telling them that the labor force is aging. So in 1994, less than 12% of workers were under the age of 55. Now we look in the next 2 years, that'll more than double to 25%. We also know that even young workers have immunization gaps, things like our speaker will talk about today, like HPV and meningitis. But they're also, due to a labor shortage and increase, I guess, due to supply and demand, it's hard to find staff. There's really a lot of scrutiny, especially when people are starting new jobs, on the benefits package. So traditionally, workplace health benefit plans don't usually cover vaccines. I'm sure you've seen that in your practice. That is starting to change dramatically with sort of the ability to mitigate risk and improve health, and especially in all workers, and the importance of including that in a benefits plan. So just quickly, some of the work we're doing to help promote Vaccine Center of Excellence is we talk to a lot of HR departments as well as health and safety teams, starting with here in BC and working our way nationally. We've got a lot of collaborations with very cool Health Canadian consulting companies. So companies like Crosslinks Benefits, who the CEO of Crosslinks was on our last webinar, which is fantastic, and really working with these organizations to advocate for vaccines. And also we're working with Benefits Canada. We're consulting on the Plan Sponsor Guide to Vaccines. So what is a plan sponsor? Well, that is basically a group organization that offers group benefit plans to its employees or members. So really making the decisions to include vaccines as well as advocating for vaccines in the workplace. So we're really doing a lot of education on adult immunization gaps. In particular, why are certain vaccines recommended and not funded, especially across different provinces? Why workplaces and employers can benefit for educating and covering vaccines, and especially the reimbursement piece. So if a vaccine is recommended, it doesn't always make its way into a publicly funded program. Again, that's a population level decision, but at an individual level, and that's as practitioners, when we see patients in practice, we're looking at the individual, and there's certain age and behavior and other risks that put them at elevated risk for vaccine preventable diseases. So that's the message we're really trying to get to employers. So this is sort of a multiple choice question that we're posing to all of the groups that we educate, is how can employers support employees in staying up to date on their recommended immunizations? And the answer is actually all of the above, but I want to highlight a key one that typically isn't addressed, and that's facilitating access to vaccinations with local community pharmacy partners. So organizations across the country are going to be educated on immunization gaps, the benefit of vaccinations, and we want to basically, and this picture tells it all, if these patients have heard about this vaccine, it was recommended, it's something that they want to seek out, how do we change from this sort of maze to navigate where to get it, to elevate your pharmacy location as a place where they can get these vaccines and the message is continuous? So if you're interested in being a part of this Vaccine Center of Excellence program, I encourage you to express your interest at vaccinecenterofexcellence.com, as well as take our free 3-module course that talks about the nitty-gritty of Vaccine Center of Excellence, how to do workplace clinics, some of the key gaps that we identify in practice. So in terms of these workshops, our expert speakers have gone over and will go over today how to have vaccine conversations in your busy practice, key immunization gaps to focus on, navigating scope of practice. So again, quite remarkable the scope of practice that pharmacists have, especially when it comes to immunizations. We should be using that, as well as workflow strategies from pharmacy immunization experts. And these were our experts. So I kicked things off in BC, then we had Carleen Alexin in Alberta, Parag in Saskatchewan. Last night it was Tiana from Ontario. And I get to introduce our speaker today, who is Michelle Stewart. So Michelle is a pharmacist, recent graduate from pharmacy school. I would say like within the past 10 years-ish, if we don't count the COVID, the 3 years of COVID. But she's a very proactive pharmacist, very clinically oriented, a huge advocate on education. So she has a podcast called The Canadian Farmer, and she has a very unique sort of experience starting in retail pharmacy, and now has a very cool innovative practice role in a walk-in clinic type setting, a pharmacist-led walk-in clinic, which is all the buzz these days. So without further ado, it's my pleasure to introduce today's speaker, Michelle Stewart. Michelle, take it away.
So much, Ajit. That was a very, very, very flattering introduction. And Thady commented in the chat. So for those of you that are watching this as a recorded seminar, you wouldn't be able to see that. But Thady just commented in the chat, laugh out loud. She graduated 10 years ago. Ha, 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 ha. Little does he know. It was probably less than that. Who's counting? Okay. So first of all, thank you so much to everyone who is listening tonight or who will be listening to the recorded version in the future. Your time will be so well spent. So please sit back and relax and take it all in, and keep in mind that there are an abundance, and I do not say that lightly, there are an abundance of resources available to you for free at the Vaccine Center of Excellence. I'll highlight some of those in a few minutes, but I've gone through all of them myself. I've saved every single one of the handouts that is made available there. Everyone, I think they're all one-pagers. They're completely comprehensive. They're easy to use. And it's all of the information that you actually would use as a practicing pharmacist, whether that's in a traditional dispensing role, whether you're working in long-term care or you're working in primary care, similar to what I do. So I just cannot, exaggerate it enough that this program is extremely well-placed and very, very timely, especially coming out of COVID. Already the vaccination rates on funded, regular long-standing vaccinations, the rates were already not to par, to say the least. And then throw COVID and a pandemic into the mix, and we're not in great shape after. So there's a lot of making up that we need to do, and pharmacists are absolutely well positioned to help some of that. to begin. So hopefully you're seeing my slides okay. I'm going to begin now with just some speakers disclosure. So I do have relationships and have done presentations and talks for various sponsors. They're listed here. I am also a member of the Pharmacy Association of Nova Scotia Speakers Bureau, and I do not have any patents on drugs or devices because there's no time for that with everything else. Okay, so program disclosure. This program has received financial remuneration from the drug companies listed below. It is in the form of an educational grant. So of course the talk is unbiased. You can absolutely count on this information, being evidence-based and applicable to your practice. But do thank those sponsors for the compensation helping to make this available to you. Okay, so this is the slide that Ajit had brought up earlier, and I'm glad that it's in my deck as well, because I think it's worth highlighting. Again, if you have not done this already, you must go to this website and look at the 3 modules. They are so quick and easy. They're easily digestible. It's not an abundance of information that isn't useful or practical. It's explained very, very well. It's very relevant. And as a pharmacist, it's one of, you could do a module tonight and use it tomorrow. It's very, very practical. So they're all free, and then you can get your certificate and register your site as one of the Vaccine Center of Excellence locations. And hopefully you'll get more people in your door, promoted through their employer to get vaccinated and make sure that they're up to date. Okay, so what are we doing? What are we doing? What is the goal of tonight's chat? So it's to appreciate the role of community pharmacy in providing vaccination services. I think we all have a pretty good appreciation of what that is after the COVID-19 vaccination campaigns that we've done. But there is so much more than that. There's more than the flu shot, there's more than COVID, and we really have to get those conversations front of mind, not only with our pharmacy teams, but the public as well. We want to recognize the heterogeneity of pharmacists' scope of practice across Canada and how it relates to immunizations. So drastic changes since I've graduated all of 5 years ago. In all seriousness, no, when I graduated from pharmacy, the thought of a pharmacist writing a prescription was, a dream in the sky. So the fact now that in the Atlantic provinces, not only can I identify my patient who, is lacking in their immunizations, first of all, identify them, then be able to educate them, make a recommendation, but just take it further to be able to write the prescription and administer the injection, finish the series, close the book, make sure that they're protected, is a huge privilege, and one that I think has been taken lightly in some instances, especially when our focus is, scattered among so many things. Really hoping that tonight's talk and this amazing program will really begin to highlight the importance of preventative health and, how it can just remarkably reduce the amount of suffering and needless suffering that people are exposed to day after day, year after year, because of diseases that they need not to be burdened with, or at least not to the extent that they are. Okay, and we're going to evaluate critical immunization gaps in your community. So I've highlighted those exist, but we'll look at a little bit more about, where are the holes and how do you find them, and then what to do when you do find them. Discuss operational strategies to optimize immunization service based on expert experience. So apparently I'm the expert, but I will use tips and tricks that I've gleaned from others that I've worked with, and also from some of the other VCE speakers. I think in totality, when you walk away from this program and after hearing this talk tonight, my objective is for you to feel empowered and motivated in your role to promote vaccination and immunizations to your patients. And when I say your patients, I do that intentionally because I think as pharmacists, sometimes we don't really feel as though we have a really good understanding or a really good stance in terms of where we fit in terms of the patients or our patients' healthcare. Whether we may defer to their family doctor for treatment decisions, or we may, send them off to a walk-in clinic to have their questions answered, or et cetera. And so now, with the lack of primary care providers, especially in Atlantic, this has really become so much more than a courtesy. this is so much more than a nice thing to do. This is paramount. This is so important. It's not being done. It's being missed because of the lack of seamless care, the lack of primary providers, the lack of consistency. There's so many barriers to having people fully immunized and being up to date. And their version of being up to date and what a healthcare provider may consider up to date can be two different things again. So we'll look at some of these things and really hope to light a fire under you to help you feel not just empowered and motivated, but excited, that we get to do this. It's a great feeling. And I'll share one story just to kind of start things off. And I think it really showcases why this is of interest to me. So I had a patient who came into my pharmacy, and she said that she called me aside, and she knew me by name because we had a conversation about immunizations the last time I had seen her, I believe. So we'll call her Marion. So Marion comes in, Michelle, can I talk to you for a second? And I said, "Oh, sure, Marion, I'll be right there." So I went down, and she said, "You won't believe what happened." And I said, "Okay, what happened?" She said, "My neighbor got shingles." And I said, "Well, that's terrible. Is your neighbor here? Do they need, how can I help?" And she said, No, they're not here. They go to a different pharmacy. But what I wanted to tell you was, they couldn't believe that I knew. They couldn't believe that I knew there was a vaccine. They couldn't believe that I had gotten it. They couldn't believe, and they were asking me here I am with shingles, and the person was having, neuralgia, and they were miserable. And their neighbor trots by and says, "Oh, I had a vaccine for that. Didn't you know?" And obviously, having, being in the depths of despair with this virus and it's being played out in real time, this patient was disgusted and mortified that they had not been privileged to this information, that they were not aware that there was a vaccination for shingles. And very quickly she said, "Well, my pharmacist, Michelle, told me about this because it's very important to her, and she tells her patients regularly, and it's not something that I asked about. It was something that was brought to me, and I made the decision, based on her recommendation." So of course that felt really, really good to hear. But it really brought it to light how important this is, and how what we're doing in the conversations we have and the interventions that we make, they affect the lives of real people and their families and their caregivers and their children. And, you just cannot appreciate the value of something like this until, unfortunately, it's too late. So I share that with you, and I hope that it will help to motivate you as it has for me. All right, so let's get into the first slide. So why is pharmacy important? Well, we know that pharmacy has made a huge contribution in terms of vaccinating against influenza and COVID. So, nationally, we know that this is a huge role of pharmacy. The public is aware of it. The other healthcare providers are certainly aware of it. So we've done a really good job. But there is so much more to vaccinations than just influenza and COVID-19. So we want to also focus on routine immunizations and recommended but unfunded vaccinations. And the reason that this is so important is because, like some healthcare providers, I would speculate that I might have thought many years ago, much like my patients, that if the vaccine was important, if it really mattered, that it would have been in my arm. My doctor would have made sure that I had gotten it. It would have been the standard of care. It would have been given to me during childhood, like all of the other vaccinations, or I would have had a special appointment. Like I was too old, but in grade 7, or, when you were given your immunizations for HPV, for example, that would have been done for me. That would have been provided. But the truth is that having vaccinations publicly funded is a tedious and very, very long process. And I can attest to that because I'm pushing right now for the Nova Scotia government to cover the Shingrix vaccination. And, they most certainly can appreciate the value in this. And they absolutely see that it's important to many of the residents of Nova Scotia, but getting the actual approval and getting it in place and having everything in order is a whole other kettle of fish. So to say that because a vaccination isn't currently funded is certainly not to say that it isn't just as important as those that are. So we'll get into that a little bit more in a second. So as a pharmacist, I wanted to share some examples of how I incorporate immunization into my practice. So as Ajit had mentioned earlier in the introduction, I work in a pharmacist-led walk-in clinic. So this was initiated a little over a year ago, so May of 2021. So we've had our feet on the ground for a little while now. The clinic very much looks like a physician-led or a nurse practitioner-led clinic, and we do in fact work collaboratively with an in-house NP. But the patients come in and they see a pharmacist. That's the standard. That's who you're going to see when you come into the door. The NP is there for collaboration, to work with us, but the patients are seeing the pharmacist as their primary provider. So it's a much different setting than working in retail, which is where I had worked previously. But in both instances, I've employed many of the same tactics to make sure that vaccination, immunization, preventative healthcare are highlighted, that they're important, that they're the mainstay of care, that they're front of mind for all the practitioners involved. And when I say practitioners, I don't just mean the pharmacy clinicians and the nurse practitioners. I mean the pharmacy assistants. I mean anybody there that's answering the phone. I mean the people that are queuing in check-ins for vaccination clinics. Everybody needs to understand why vaccinations are so important. And it's more than just saying, this is what's recommended or these are the guidelines. We really have to make everyone on the team aware and appreciate the value in what these vaccinations can do. And I think part of that comes back to talking about the actual diseases they prevent, and we can talk about this in a few minutes, but how, when's the last time your friend had polio? When's the last time you went to visit your mom in the hospital because she had mumps? Or, so all of these preventable diseases, because we've been vaccinating against them rather for years and years and years, they've become less common. People have less of an appreciation of what the diseases that can be vaccinated against, what those diseases can actually do to people, and it does cause fatality and it does cause huge, horrible sequelae can come from being infected with these diseases. And I think that's part of the message that we have to get back to. We have to start to really emphasize and show people that, we're talking about vaccinations, but it's more than a conversation. This is what we're actually preventing. So when people could appreciate, especially with the campaigns around Shingrix, when they could see on television, Shingrix doesn't care or shingles doesn't care, and they could see visually the torment and the suffering and the misery that people would endure needlessly. Again, I want to highlight when they would see that, they could appreciate the reasoning behind making an effort to ask about the vaccination or making an effort to get the booster, to return to finish the series. So I think we have to do a better job of that in terms of everything, whether it's tetanus or pneumonia. Invasive pneumococcal disease is another one many people haven't even heard of. Most people know about community-acquired pneumonia, but certainly not invasive. Also, aside from tetanus and diphtheria, for example, and I think diphtheria and this comes from one of the modules that the guys did, which was excellent, but diphtheria used to be referred to as the strangler's disease, I think, or stranglers. I wrote it down. Anyway, basically, a plaque, residual matter start to grow within your tongue and within your airway, and they can actually close it off completely. And people have died. So, when we're talking about come in for you bring your baby in for your needle we're not having conversations about exactly what we're trying to prevent. And so that would be one of the biggest things that I have found value in doing in my practice is to really help people to understand, this is why. We really have to explain why. This is why I'm taking the time. This is why I wanted to have this conversation with you. So if I'm talking to Megan from Sydney, I may say, listen, Megan, I wanted to pull you aside because I know that you're diabetic, or I know that you have chronic kidney disease, or I know that you're about to start treatment for Crohn's. And because you're at risk, whether it's because of, their immune system or medications they take, regardless, or just because of their age, whatever the reason, I've identified you specifically. I want to talk to you specifically because I have concerns as your healthcare provider and I need to look out for your best interests. So very much like I trust my mechanic, when they put a sticker on my windshield that says that my car is road ready, my impression is that I can put my children in the backseat and that they're going to be safe. When your patients leave your pharmacy, they presume that had you not had this conversation, it probably doesn't matter. So the fact that you're bringing it up, that you're, talking to them one-on-one, and that you're showing them why this pertains to them especially, really helps to bring the focus as to, the importance of having this done. So those will be some of the best tips that I could give, is to really help not just people, your colleagues, the people that support your practice, the company that you work for, and then the public that are coming in and trusting you, with their healthcare. Help them to understand why this is important to you. And I think, you really have to dig deep as a provider and go back to, do I buy in? Yes, of course I buy in. Of course I believe in vaccinations. Of course I believe in immunizing my patients. I'm a pharmacist. Okay, but why Tdap? Why do you believe in Tdap? Why do you believe in pneumococcal? So understanding, because there's such a huge impact, the fatality rates are very, very high. We know, and we'll talk about some of these in slides to come. So I'm skipping ahead, but that will be my biggest tip. And incorporating those conversations is so easy because there's always questions at the counter. So when someone has a question about, should I be eating this, or should I be doing this? Or, is it okay if I do this? Can I have grapefruit juice with this medication? Any question is an opportunity to insert a tip regarding better health outcomes. So yes, if you want your medication to work better, take it on an empty stomach. If you want to make sure that your immune system is maintained and that you're protected, I also recommend that you get this vaccination. I see that you're now eligible because you've turned 50, for example. So just making it commonplace and having the conversation with your pharmacy assistant so that when a patient has an inquiry, so when someone comes up to the pharmacy counter where I work and they say, I was wondering about the shingles vaccination, is there someone I can talk to? They know immediately if Michelle's available, she wants to go. She wants to have that conversation. And the pharmacy assistants know immediately how much of a believer I am in the vaccination and can even speak to that themselves because the majority of them are up to date, if not all. Okay. So scope of practice, despite national consensus on pharmacy curriculum education, pharmacists across the country have different scopes when it comes to vaccination, and they have different scopes when it comes to many things. Vaccinations are no exception. So we're going to focus on what's happening here in the Atlantic provinces. And I am very pleased to say that it's all good news. So I did put together a quick slide. This is a picture of one of the rooms at the walk-in clinic. And to the left is an overview of injection authority and vaccine administration in pharmacies across Canada. So I've highlighted the Atlantic provinces, and you can see, aside from the red box, there is no red. So pharmacists have the authority to inject and prescribe all of the vaccinations listed. And you can see that the list is lofty. So when you look at this as a pharmacist, and as you look at this as a primary care provider, which we're more and more, be put in that position. When you look at this list, I hope that it gives you not only a feeling of empowerment, but also a feeling of responsibility. This is within your scope. This is in your wheelhouse. And this is something that should be at front of mind and something that you should be having a conversation about a vaccination at the very least 2 to 3 times a day. Very easily it should come up 2 to 3 times a day. And some of the easiest ways to bring them up are things like stapling a brochure to a patient's prescription bag and saying, for patients, this is indicated for patients over 50, and maybe just circling that with one of your markers and having the pharmacy assistant grab you when the patient comes in to pick up the prescription. Listen, John, I put this pamphlet on your prescription bag. I wanted you to have a look at it. I feel that it's very important. I highly recommend it. You're turning 50 next month. And this is something that I think we should plan for. Do you have any questions? Let's set up an appointment. So really, when you look at this chart, like I said, it's completely within our scope. And I would go further than that to say that our professional colleges, the expectation is that we are having this conversation. The expectation is that we are regularly participating in preventative health care. Okay, so critical recommended unfunded immunization gaps. So back to my point about being unfunded. Some people rationalize within their own mind that if the government isn't paying for it, then, it must not be worthwhile, or it's not as important as those that are government funded. So obviously that's not the case. As I mentioned earlier, having government funding behind vaccinations or any kind of medication requires, lots and lots of steps, many, many people involved, and can take a very long time. So we want to make sure that pharmacists are positioned, and they're already well placed, but in right position and ready to go having the information in front of mind so that they can immediately address these gaps, not only just, I should say, really to be able to identify the gaps. So that should be intuitive, and then to address them, and that's the part where it takes a little bit more, guts. So we need the wisdom, we need the insight, but we also need the guts to make sure that we get the job done. And that's really just about opening your mouth and having the conversation and having confidence in what you're talking about. So you can feel very assured that your fellow colleagues, and if you need any support in that, I again recommend you back to the Vaccine Center of Excellence, because there's a robust information there. All of the support that you need is there. Any question that any patient or other provider could possibly ask you, I assure you that the answer will be there for you. So you have everything that you need, and you should feel confident. You should feel confident in your recommendations, and you should feel confident in being able to identify people that need you, identify people that need you to intervene and need you to make these recommendations, and bring it to their attention. Because much like me with my mechanic, if he didn't tell me that this or that was about to fall apart, I would be none the wiser. So, much like we trust our mechanic, our folks are trusting us to help to identify these things for them. So in older adults, so we're talking about people beyond the age of 50, which are really tremendously young, but we'll call them older adults in comparison, to infants. So for older adults, Shingrix, pneumococcal, and enhanced influenza are the three biggest vaccinations that are being missed. And I would add HPV to this as well, because there's many, many, many older adults who, like myself, were not immunized against HPV when they were in school. It may not have even been a discussion at the time, or perhaps it was a male and they were, only females were being vaccinated. Regardless, there are many people who are very much eligible. There's no upper age limit for HPV vaccination. So they're absolutely eligible to be vaccinated and have just not had a conversation. No one's brought it to their attention. So for myself personally, I can tell you that I did a presentation for the Pharmacy Association of Nova Scotia, I think it was. And in doing research for the presentation and learning more about HPV vaccination, I was appalled that I had not gotten it. And now I'm fully vaccinated. But here I was, in the cohort that I'm in. I had, it wasn't available to me when I was in grade 7. I'm not 27 years old, even though I look it. I am older than 27. So that area where it's, predominantly recommended between 9 and 26, 27, I'm beyond that. So no one thought to bring it up to me. But HPV, I'm still absolutely eligible for this vaccination. I absolutely did want to have it. I just didn't know how important it was until I started reading about, all the evidence behind it. In fact, the World Health Organization has said that if we could globally, for the majority, vaccinate women against HPV, that we could potentially eradicate cervical cancer. That's pretty profound, right? So of course I want to have that vaccination. And of course I want my patients to have that vaccination. So learning about this, being here tonight, listening to this conversation, going and doing the modules on the VCE website, that's your contribution. That's how you're showing up, not just for yourself and your family, but also your patients. So on behalf of them, thank you. So back to Shingrix. Shingrix is indicated in folks ages 50 and up. Age 65 and up is oftentimes when you will have government funding. So in Prince Edward Island, recently, we just got some government funding for Shingrix, which is fantastic. Here in Nova Scotia, we haven't gotten it. We're still working on it. So hopefully it won't be the case much longer. But 65 sometimes is the age when government funding kicks in. Age 50 is actually when folks are eligible for the vaccination. So there's 15 years potentially where they could become infected needlessly. So helpful, so beneficial, and so appreciated, as the patient I spoke about earlier who came in to tell me that her neighbor had gotten shingles, that attests to the fact that this is so important, not only to us as providers, but also to our patients. So making them aware, as soon as you turn 50, you're eligible for this vaccination. And in fact, if you're still working, maybe your employer will cover it. Whereas if you wait until you're 65 and you live in a province that doesn't cover this vaccination, you would have to pay out of pocket. So all the more reason to get it now. Get it now. Get it now. There's also recently been a change to the indication for Shingrix. So before it was ages 50 and up, and we knew that was I think pretty common knowledge. But now we can actually vaccinate people against shingles much, much sooner. So as soon as they turn 18, we can start to contemplate whether or not it would be appropriate. And in people who are immunocompromised, either by medication or by disease state, they would be much more at risk of getting shingles, obviously, because the virus is dormant. And, waits for this opportune time when a person is beaten down and tired and their immune system's busy with other things, that's when the virus will peak. So we know that people who have Crohn's disease or who want immunosuppressants, Remicade infusions, for example, for their Crohn's disease, those people's immune systems are very much distracted. They're very much depleted. And so they're perfectly positioned, to be infected with shingles. So those are the people we need to protect. So again, talking to people over 50, but also talking to people that may be at risk because they are immunocompromised less than 50. Pneumococcal, I think in pharmacy, we often assume, wrongly, we assume that's taken care of. My patient has COPD, they've been in hospital for an exacerbation, or they've just come from their physician and they have refills on their inhalers. They must have been vaccinated. Please don't make that assumption. So, we have folks that are moving between providers. We have people that are moving from province to province and don't have updated immunization records. So, there's so much that can be lost to good documentation and good record keeping. But there's also so much that can be lost to just not tracking, and just not bringing it to people's attention. So it's so important to have conversations about, even we talked earlier about unfunded vaccinations and how we have to highlight those for people, but funded vaccinations as well. So pneumococcal vaccine, a person, who is otherwise healthy could go through their life. I've had people that come into our walk-in clinic who, the last time they've seen a physician was 20 years ago. So they're not regularly being screened. They're not regularly being given advice about preventative healthcare. And so these people very much could be in a position where they have not been previously vaccinated and are most certainly at risk. Actually, we've had people within our walk-in clinics, no kidding, like more than a dozen, who have come in with an A1C, 9, 10, 11, and were completely unaware that they were diabetic, right? So here's somebody that would have been, had we known or had they known that they were diabetic, should have gotten their pneumococcal vaccination much, much earlier. And now we're having to, try and compensate. So all to say that these vaccinations are extremely important. As we get older, our immune systems are not as strong, they're not as robust. We don't even form as much of an immune response when we're vaccinated. So imagine the people that haven't been vaccinated at all. So these people really deserve our attention, and they really deserve, the chance to benefit from the vaccinations that they're eligible for. In terms of adolescents, the two biggest ones that pop out, HPV that I mentioned earlier, but also MenB. So I'm going to talk a little bit about MenB because it's absolutely relevant, especially now we're in late August. So people are getting ready to go back to university, and that typically is one of any kind of communal living, but university in particular, where people are smooching in the hallway. There's a tendency for close proximal relationships, but close living quarters, no kidding. So because of that, we know that MenB is much more prevalent, and because it is such a aggressive infection, it's that much more important that we protect people against it. Okay, so let's look at shingles by itself. And I think I've gone through a lot of this already, but it is recommended by NACI. So this isn't, it would be nice kind of vaccination, or maybe this would be beneficial. We know, one of every two people, by the time they reach 80, are going to get shingles. So there's a 30% chance of lifetime risk. So that means that between my husband and I, by the time we're 80, one of us will have the infection. And the older you are when you get it, typically the worse the infection will be. So you can have long lasting, terrible neuropathic pain. You can have, obviously lesions that if it were happen to have the infection that around your eye, it can affect your vision permanently. So, this isn't something that is benign, most certainly, and actually can be very, very painful. And I had a woman, she and her husband had, they lived in town close proximity to my pharmacy, but they also had a cottage, and they thoroughly enjoyed their summertime months at the cottage. And I can remember the husband had come in and said that his wife had gotten shingles, and, you know, they were looking for ointments, anything that could help with the pain, because she thought that it was mosquito bites and it hadn't gotten treated, and go on. So it was a terrible infection. And she actually, because the pain was so bad, it wrapped around her shoulder, she couldn't lift her arm. It was excruciating pain when she would lift it. We tried gabapentin. Anyway, as you know, as I know, there are very limited medications to treat neuropathic pain. And of the ones that we have, the efficacy isn't, you know, where we want it to be. So she was in terrible pain. And they actually ended up having to sell the cottage because she required assistance now to dress and, you know, just daily living. And he wasn't in a position to be able to care for himself and her as well. And just very, very sad, all because of shingles. I mean, these are people that were out golfing every other weekend, and their lives were totally upheaved because of it. So age over 50 is when it's recommended, again, unless they're immunocompromised. So there is an expanded indication for that. So how do I talk about Shingrix vaccination with my patients? I'm very direct, and this is what works for me. I'm very direct. So I don't, you know, it's not a lighthearted conversation. How do you feel about vaccinations? Have you ever heard of this? My conversation sounds more like, I need to talk to you about this. I need to make sure, for my peace of mind, it's my job, it's my role to make sure that you're aware that you're eligible for this vaccination. And I absolutely think that you should get it. That's my approach, because that's how passionately I feel about it. That's what I would want my mother's pharmacist to say to her. That's what I would want my dad's pharmacist to say to him. So I treat my patients very much the same way, you know, that I would want a member of my family to be treated. And that's how I would want it to be addressed. I would want them to really understand and appreciate how important this is, and not wait to have to learn the hard way, or to watch someone else suffer. You know, when you're seeing someone else, much like my patient who saw her neighbor going through this horrific episode with shingles, you know, you could see it really sunk into her. And she was telling everybody that she knew that they should be vaccinated because it started to resonate. She could see, you know, how terrible it could become. Okay, so now let's shift over to pneumococcal disease. So being vaccinated for pneumonia. So when we talk about pneumonia with most of our patients, I think what their, you know, instinct is to think about community-acquired pneumonia, but there's actually two different types. So we have community-acquired pneumonia, but we also have this invasive pneumococcal disease, and that can result in things like meningitis. So two different conversations. And the reason that we have different types of vaccinations, and the reason that we'll often kind of layer them on one another, is because the conjugate and the polysaccharide have different levels of coverage, but they also work in different ways. So we want to make sure that we are vaccinating patients at the appropriate time, so early enough to make sure that they're going to benefit, especially if they're immunocompromised. Also want to make sure that they're completely covered so that they're getting benefit against all of the potential strains that could infect them. And we want to make sure that they're spaced appropriately so that they gain the best of the best immunogenicity from each vaccination. Okay, so how do I talk to my patients about pneumococcal vaccination? Well, first of all, because many people have heard of pneumonia or ammonia. I don't know if you've heard that in your practice, but I've heard it often. So many people have heard of someone having pneumonia, and they may think of it as, you know, just a very basic upper respiratory infection. Maybe you get an inhaler, maybe you have a bit of a cough. So really helping them to understand that pneumonia can become much more than, you know, a transition between a cold and the flu. So I think it's really important to begin the conversation, again, in the same way that I would talk to someone about Shingrix. And that will be to identify individuals based on their individual risk factors, their individual circumstance, and really highlight to them why they should be vaccinated. So in terms of pneumonia, age 50, you know, that would be, age is always like a really, really good indicator. And it's a really good instigator for me to really get my mind in gear. So, you know, it's one of the first things that I'll look at when I'm either checking a prescription or writing a prescription or reviewing a patient file. you look at their date of birth, you see how old they are and what cohort they're in. So is it a child? Is it an adolescent? Is it an adult, or is it an older adult? So if I'm seeing someone who's an older adult, if they're 50 plus, immediately I'm thinking about shingles, pneumococcal. I'm missing one, but I'll come back to it. I don't know where that went. Anyway, influenza for sure. So obviously those things are front of mind. And if they're not front of mind for you tonight, that is okay. Because as I mentioned, you have all the resources that you need to be able to get you there. But don't feel because you don't have something memorized that you're not well positioned, to promote it. So you have the resources that you need. Start with one vaccination, pick one. Whichever one interests you the most, learn about what happens if the patient doesn't get vaccinated. What does the disease actually look like? How does it show up? So that you can talk to your patients. And I'll say, I've had patients, because you have a history of smoking, or you have COPD. Obviously, I worry about your lungs, or because you're diabetic, your immune system is deficient. It's just not the same. It's not up to par as someone who isn't diabetic. And we know this, we know that comorbidities increase people's risk. So because I see that with you, I want to protect you. And this is what we need to do to make sure that happens. So that's my approach. And that's how I talk to my patients. And then you can get into specifics, certainly, in terms of, when they should be vaccinated and timing between vaccinations. And all of that, again, is available, for your convenience. But having little reminders, whether it's a sticky note that you put on the prescription bag, maybe it could be a stamp that you stamp onto the counseling documentation. It could be a conversation with a PA. Hey, listen, Megan, today we're working together. I want you to know I want to vaccinate people. I want to make sure that we're really focusing on keeping vaccination against Men-B. For example, Men-B would be a perfect place to start this time of year. So if you are at the counter and you're talking to people and you happen to learn that someone is heading off to university, please make me aware, because I definitely want to have a conversation with them or their family member or whomever about Men-B. Okay. And I'm talking about Men-B when we're still talking about pneumococcal, but you get my point. Those are my approaches. Okay. HPV vaccine. So as I mentioned before, being vaccinated for HPV can prevent cancer. So that's the last point on the slide, but to me, it's one of the most important. The C word, it's a huge fear. I don't know anybody that wouldn't, wince at the thought of, having a conversation with their physician about their risk for cancer or suspected cancer. It's a very scary situation. So to be able to comfort people and to say, and this has come up also in my practice where people say, so-and-so, my husband has been diagnosed with this, or my friend has been diagnosed with this type of cancer, and I just feel so vulnerable and I'm so scared, and this can happen to anyone. And, this is something proactive that we can teach our patients. This is something that you can do. And no, I can't assure you that it will eradicate you, any chance of you ever getting cancer, but it will most definitely reduce your risk of getting specific cancers, and cervical cancer is absolutely one of them. Head and neck cancer as well, especially in men. So HPV virus, there's no discretion between age. There's no discretion between gender. So it's recommended for both boys and girls. Both can be carriers of and infected with HPV. I mentioned this before, there's no upper age limit. I was vaccinated within the last few years for HPV, and I would highly recommend that if you're listening tonight and you haven't been, that you get vaccinated and do the same for the patients that are counting on you. So it is an approved indication for the prevention of head and neck related cancers as well as cervical cancer. Okay, so how do I talk to patients about HPV? Well, in Nova Scotia and many of the Atlantic provinces, if not all, we're writing prescriptions now for contraception. So relatively new in some provinces, but we've been doing it in Nova Scotia for a little while now. And that is a wonderful, wonderful place to pair a conversation about HPV vaccines just with therapeutics of contraception. So you're having a conversation with someone interested in contraception, this ties in very nicely with that. So while I have you in the room, I want to make sure that this has been brought to your attention. Did you know that you're eligible for this vaccination? I highly recommend it. I've gotten it myself. This is why. And really that would be how I would approach it. The other thing would be, community outreach. And if you're not a public speaker, you don't necessarily have to do a presentation to a local high school or a community college or whatever, but it could be just a letter to the school principal saying, it would be really great if you could highlight this in your newsletter, if you could put this on your home and school page, whatever. This is, on behalf of the pharmacists in the community, this is really a major importance to us. And we want parents and adolescents to understand why it's important to show up on the day that vaccinations are being given. For some people, that's very intimidating. In grade 7, I think they get 2 or 3 vaccinations at once amongst their peers, in their high school. And that's a lofty, task for a lot of young people. So to be vaccinated, many people have fears and anxieties around the needle poke or about the vaccine safety and efficacy itself. So really helping to bring awareness around what you're protecting yourself against, how it works, how safe, incredibly safe it is, and the long-term benefits. This isn't something that you get today and it helps to protect you today. This is something that's going to continue to protect you throughout your life. So it's really, really important that you do it. So again, however you can make that happen, whether it's reaching out to a school or a group in your community, regardless, I think it's really, really important. But at the very least, if you're filling a prescription for birth control, if you're filling a prescription for acne, in a young person, or even that cohort like myself who would have missed it in grade 7, so anybody between, I think it would be ages maybe 35 and up right about now. And I could be off a little bit on that. I'm not sure, but, to bring up conversations around, would you have gotten vaccinated for HPV when you were in high school? Did you get vaccinated in grade 7? No, I didn't. Okay. Well, like me, you would have missed out on this vaccination. I think it's really important. I went ahead and got it. And I think that you should too. Okay. Meningitis B. So meningitis B is it's a strain of meningitis that isn't covered in the meningococcal vaccination that we're given early in life. So we are not routinely vaccinated against the B strain. This vaccination, in fact, is not often discussed, in regular office visits, from my understanding and speaking with most patients that I've interacted with. So aside from me, no one had ever brought up being vaccinated from MB. So there is a high burden. I mentioned before that there are certain groups that are high risk. So we think of it often in terms of adolescents going off to university, but there could be others as well. So people traveling in small groups or living, doctors, what is it with borders? See, this is the problem. And this is the problem too, because I'm sitting here talking to myself and I feel like, anyway.
Doctors Without Borders. Yeah.
And it came to me as soon as your voice, Doctors Without Borders. So example, Doctors Without Borders, you're going to be traveling with a group. You're going to be living in a remote village, clumped together in tents, whatever. Maybe a good idea to think about being vaccinated from MB. So just to say that, there are more opportunities for vaccinations other than just those that are commonplace. Okay. So because I am from Nova Scotia, and because I went to Acadia University, and because I care, I wanted to highlight the huge effort that has been put forth in this area against vaccinating against MenB. And that is in honor of this young man. His name is Kai. He was a student at Acadia University. And within hours, so here, right on the poster, within 30 hours of getting MenB, Kai lost his life. So although this isn't, it's certainly not an epidemic. It's far from a pandemic, but it's happening. People are being infected with this. They're becoming very, very, very sick. And some people are losing their life to it. So it's very real. And if this was my child, knowing that it could have been prevented, would crush me. So again, just so many good reasons as to why to have these conversations, but to be able to put a face, alongside the importance of this, I think tells a story in and of itself. So there is a website. If you'd like to learn more about this initiative, please do beforkai.com. And I'll definitely be doing all I can to support it on my end. So how do you talk to patients about MenB? So much like HPV, you might target people that are every September, late August, we're filling 6 months of prescriptions for travel. So, and when you look and you see that they're in their, late teens, early 20s, you would presume that they're going away to university. So being able to tack a sticky note or, putting a stamp or some kind of a reminder so that when whoever is coming to pick up that prescription, when they arrive, a pharmacist is going to go down and be well-positioned, ready, prepared, knowledgeable to explain to them why they've been identified to have this conversation. That would be my strategy. Other things would be, as you're working in a pharmacy, especially if you've been in the same pharmacy for years and years, you really get to know people and the different generations. So you may be talking to the mother of someone who's about to leave for university, but you can anticipate this because the entire family. So that would be worth mentioning. If you know anyone within your family, within your neighborhood who is leaving for university in the fall, I think this is really important. Or even in terms of pertussis vaccination, I'm forever bringing up to patients that, they'll come in and they'll say, "You'll never guess, Michelle," because you become really a part of these people's lives as you've known them year over year over year. So they would come in and say, "Michelle, you'll never guess, my daughter Mary is pregnant. We're going to have our first grandchild." And the first thing that pops into my mind is pertussis. We need to get you vaccinated if you're going to be kissing that baby. So really just, being able to relate to your patients and to their individual circumstance and use that to protect them and to help them understand why it's important. Okay. So the how-to part of the presentation. So we've talked about why it's important. And of course, you went into pharmacy because you care and because you want to protect people. So all of that, I think, is, common knowledge. We all want to help. We all want to do the best we can. But how do we make it happen when you're in a pharmacy and it's busy and, you're being pulled in a lot of different directions and you're in the middle of, everything and constantly being pulled away and multitasking? It can be really difficult. So how do you make this happen? Now we've got your buy-in. You can see it, you can feel it, you want to be, out there promoting it and you want to protect your patients. But how do you do it? How do you keep it in the forefront of your mind? Because we're all well-intentioned, but it's very easy to let the day slip by. And then as you're driving home from work that night, realize, what? I don't think I wrote a prescription for or injected anyone for shingles or pneumococcal or HPV or MenB within the last 24 hours. So how did that happen? Because it is a priority for me and I do care. Well, the reason that happens is because, like I said, time gets away from us and we really do need a strategy. So how do you make that happen? And the first thing, which I alluded to earlier, is that it has to be a team effort. And that sounds so cliche, but it really, really is the key to your success. You have to get all of your teammates on board. And even if they don't want to take the lead on immunizing or writing prescriptions for immunizations, even if they know that that's a priority to you and that you're comfortable doing it, then they can make those recommendations to you. And as they see you do it, and as they hear you having conversations at the counter with patients, they'll become more comfortable as well. Letting your pharmacy assistants know. When if I cover in a pharmacy, the first thing I do is talk to my pharmacy assistant that's going to be working with me during that shift. And I'll say, "Listen, if you have any patients that come in and they're without medication or they have questions, whatever, don't hesitate to ask me. It's, I'm not too busy. It's not a burden. That's what I'm here for. I'm down with all of that. I'm very, very comfortable. Let's, we'll get the job done together." So I would also have a conversation. Look, we're going to be working together with the next 8 hours. The fall's coming up. A lot of people going back to school. If you've learned that someone is going to be going to university, or you've learned that someone's going to be starting chemotherapy, or you've learned that someone's just recently diagnosed or suspected diabetes, let me know, because those are all people that I should be having conversations with about vaccinations. So that's the number one thing, is make it a priority, not just for you, but your entire team, and then incorporate it into your day. So some people prefer to do it little by little. Look, I have you right here, right now. I'm doing your INR anyway. Let's just do the pneumococcal vaccination. We both know you need it. We both know you're due for it. Let's just get it done. Conversely, you may feel that it works better for you to do all of your immunizations rather in the form of a clinic. So maybe that's a clinic off-site, or maybe it's a clinic within your pharmacy where you have extra staff come in. But the point is that you have to have a strategy and you have to be able to plan for it. So for me, at the walk-in clinics, on our intake form, we automatically have a section saying, check the box. I have been vaccinated against pneumococcal. I have been vaccinated against shingles. So the list is there and the patients check the box. Now, some of them don't know what they mean and they leave them blank, and that's okay. I'm going to ask them verbally and we're going to have the conversation. But it tips me off to make sure that that's a consistent part of my workup on the patient, but it also brings it to the patient's attention. And when it's on, along with your allergies and medical conditions, I want to know what you've been vaccinated against, because it's equally as important. So it really helps the patient to understand, this is how this clinic operates and this is a priority of this pharmacy. And we're all on board. So I think that's a really important message. What are some of the biggest challenges that you face? I would say that one of the biggest ones would be time. And I say time in quotations because, the time is there. We just have to be able to prioritize where we focus our attention. And being able to do that and being able to do it effectively takes time, and it takes skill, and it takes practice. So I would say don't get frustrated and don't be discouraged, and don't have a goal that is so lofty that you'll never achieve it. So make a goal, and whether it's between the pharmacy assistants that I'm working with today and myself, let's see if we can, reach out to 5 people who are eligible to be vaccinated for shingles and really help them understand and make them aware. If, by the end of our shift today, we can identify 5 people, even if it's a matter of the pharmacy assistant saying, I noticed that you're over 50. Our pharmacist really likes everyone to be aware that they should be or are eligible to be vaccinated against shingles. So I've gone ahead and put a pamphlet in your prescription bag. But if you like, I can go ahead and get the pharmacist and she can talk to you about it, or we can schedule a follow-up visit where you can come in and discuss it with her. But just to really exaggerate the importance of it and really help them to understand, whether they're dropping a prescription off, picking a prescription up, or shopping for an OTC item. Echinacea, for example, people constantly trying to improve their health on their own, constantly trying to build their immunity, whether it's out of fear or preparation or, just trying to be more health conscious. People are making an effort. So help them to understand where they can best utilize products to promote their own health. Other challenges would be just organization. So you really need an ally in terms of immunizations. You need someone that is going to help you not only with the mindset and the initiation and the motivation to get this done, but also coordinating it all. So making sure that you have the inventory you need. I've worked with pharmacy assistants who, if I was having a conversation at the counter about shingles with the patient, and I said, this is something you really should have, they would hear the patient say, you know what, Michelle, I do want to do it. Well, the next thing I know, the Shingrix shot is in the private counseling room. The lot and expiry are recorded. The 25 gauge syringe is there with the tip, the alcohol swab, like they've got it all set out for me so that we can get it done as quickly as possible. And, they feel empowered to do that. They know what's required and we make it happen. So I think that's one way to get, around some of the challenges, and just making sure that you have what you need on hand. So if you decide I'm going to focus on immunizing people against shingles, I'm going to start with that. Order it in, have it in your fridge, make sure you know how to draw it up and you have all the supplies that you need to get the job done, and that it's handy so that you're not having, it may only take 5 minutes to have the conversation and another 2 or 3 minutes to get the injection in their arm, but it might take 25 minutes to find the alcohol swabs and the proper injecting equipment. So making sure that you can delegate that to your teammates is a huge, huge win. So parting words of wisdom. So 3 tips that I wish I knew when I started out for pharmacists who want to optimize their pharmacy immunization services. The first thing is you need to know how important you are in terms of people's health. You need to understand that you have an important role. And I say that so genuinely because you really have no idea how much people appreciate the tiny bit of advice that you might impart on them that you think is commonplace, or everyone knows this, or, it was no big deal. I changed their medication from a BID to a once a day long acting. It was no big deal. The SR formulation was covered. I just switched it over and now they don't have to take their med twice a day. That can be huge for some patients who weren't taking their nighttime metoprolol dose and at increased risk of, a morning heart attack, for example. So all of those things really do add up. They can make a huge impact on patient care. So, and people's lives. When I say patient care, I mean like the day-to-day lives, like the woman who had to get rid of her cottage and the people that are visiting loved ones in hospital, that are intubated because they have invasive pneumococcal disease, and were eligible for vaccination but never got it. So at the very least, maybe they would still get pneumonia. We can't say for sure that they wouldn't, but it probably would not be as aggressive, and they probably wouldn't have the symptoms that led them to hospitalization if they were properly immunized. So that would be my number one tip. Have confidence in what your role is and what you can impart in terms of knowledge, and not just knowledge, because now we can actually implement it. We're not just, providing information to people and educating them. We're actually putting the medication into their arm, which is so much bigger than, I had ever hoped. The other tip that I would give would be to continuously update yourself and challenge yourself, to be competent in the area of immunizations. It's one of the things that's, never going to go away. There's far too little focus on it. And it's crazy. I mean, it's so important when you look at there, and you will, I'm sure, when you go on and do the modules, when you see the infographics and the statistics and the terrible things that can happen, it's easy to buy in. It's easy to understand. So I think really, if you can make it a priority for yourself as a healthcare provider to stay up to date and to take on challenges like this and to participate in talks like this, I think that would be another big tip. And the third one would be, to address immunization and vaccines sincerely, genuinely, but also assertively. This is important stuff, aside from clean drinking water. I don't know that there's anything that promotes better health outcomes than vaccinations. So this is a big deal. And I hope that you would feel not just empowered, but confident, and be assertive when you make your recommendations. There is vaccine hesitancy, but that's not necessarily anti-vax. People can be hesitant because they don't have the information that they need that would make them feel comfortable. So being able to impart that information is critical. I'm not sure where we are for time, but I'm going to stop here and let Ajit rejoin us and check in. So how's it going, Ajit? I see that there's something in the chat.
I don't see any questions in the chat, but I just want to say thank you so much for your very detailed presentation, especially how you made it so personal. And I think that really makes recommendations impactful. And you mentioned how being direct is your style, and the data supports that. We want to it's more of a pragmatic recommendation than just a participatory ask when it comes to vaccinations. And I really like the example you did on the mechanic. I think that's just so interesting that we would always expect to have our car problems fixed before we leave the shop. And unlike a car, if it's not the case, you can just buy a new one, but you can't buy a new body. So that's just such a very powerful way to do it. Lots of good stuff in the presentation. I did take a lot of notes. I don't see any questions in the chat, but I do want to ask a quick question about access to publicly funded vaccines. So is that largely done through the health units, or can pharmacists do catch-up immunizations?
Absolutely. So again, unfortunately, right now, pharmacists in community pharmacy within the Atlantic provinces do not have access to publicly funded vaccinations. So we are ordering them from wholesale, and then people are paying out of pocket, or it's going through private insurance. But within our walk-in clinics, now that we're working with nurse practitioners, we're seeing this huge opportunity for the NPs, obviously, to be able to order in publicly funded vaccinations, but for the pharmacists to be able to prescribe and inject it, and to follow up with the series and keep track of all of that. So definitely some novel approaches that we're taking on right now. But even in regards to unfunded vaccinations, I think one of the conversations that we forget to have with our patients is that, if this is important, if this is as important to you as it is to me, you need to make your MLA aware. You need to make them, accountable to you as a taxpayer, and let them know that this is very, very important to you, and that it's a priority, because that's where the message really takes hold. So those would be my parting words, is to make it is a big deal. So let's make it a big deal, and let's let the cat out of the bag and make everybody aware and get this done. We need to get it done.
Absolutely. And you're certainly doing a lot of great work as in that innovative practice with a pharmacist-led walk-in clinic. We really hope that we'll start to see that more out west in BC as well. So thank you so much, Michelle. I really appreciated your presentation today, and what a fitting conclusion to our Vaccine Center of Excellence national series. Thank you to all of our attendees. If you have any questions, feel free to reach out to myself or Mark. And as Michelle says, please check out the modules and stay tuned. This is just the beginning of a really cool national initiative to protect more people against vaccine preventable diseases through their knowledgeable pharmacists. So thank you so much, Michelle, and take care, everybody.
Awesome. Thanks for all you're doing. So happy to be a part of it. Good night, everybody.